Hello everyone, I'm Sharon, a dietitian at Efione. With over 10 years of experience in consumer nutrition consultation, today I'll be introducing two products, new Lopo and new Reno. Starting with new Lopo, I will explain chronic kidney disease, CKD, the principles of nutritional treatment, and how new Lopo can benefit patients with chronic renal failure, supported by clinical evidence. 20 years ago, Taiwan's government recognized the issues related to dialysis and its impact on public health, quality of life, and financial burden. They advocated for early detection, regular monitoring, and efforts to improve kidney disease outcomes. According to WHO statistics, kidney disease affects 10% of the global population, meaning 1 in 10 people suffer from kidney issues. In the Philippines, kidney disease is the fourth leading cause of death, with 36 deaths per 100,000 people, surpassing hypertension and diabetes-related mortality rates. The kidneys are silent organs, and once damaged, they are unlikely to recover, making disease management and protection a priority. CKD progresses through 5 stages, with the most prolonged period being the chronic renal failure stage. During stages 1 and 2, kidney function remains relatively normal, but signs of proteinuria and hematuria may appear. Patients should maintain a balanced diet, avoid excessive processed foods, and manage blood sugar and blood pressure. At stage 3, with an eGFR less than 60, it's crucial to follow CKD dietary principles and control daily protein intake with checkups every 3 months. By stage 5, dialysis becomes necessary. Preventing the progression of kidney failure is vital. The 2024 KDIGO guidelines emphasize managing blood pressure and diabetes, both closely linked to diet. Since the kidneys contain many microvessels, high blood pressure can damage the glomeruli, impacting kidney filtration. Similarly, fluctuating blood sugar levels can harm the kidneys by soaking them in excess glucose. Thus, managing both is essential for kidney care. A 2021 Philippine Heart Association (PHA) report noted a hypertension prevalence of 37%, up 32% from 2013. The Precision 4 trial showed that more than half, 58%, of hypertensive Filipinos had target organ damage, with 17% suffering from kidney issues like hypertensive nephropathy. Moreover, 27% of diabetes patients also have CKD, making careful food selection and seasoning use critical. The kidneys are responsible for metabolizing toxins and excreting urine, filtering excess water, eliminating nitrogenous waste, producing erythropoietin (EPO) to support red blood cell production, producing renin to regulate blood pressure, activating vitamin D for calcium storage. Once the kidneys are damaged, you will face the following nutritional problems. 1. Protein loss leads to bubble urine. 2. Albumin loss leads to edema. 3. Reduced EPO erythropoietin leads to anemia. 4. Excessive metabolic waste products in the body and anemia lead to fatigue. 5. Loss of bone calcium leads to cardiovascular diseases such as osteoporosis and vascular calcification. 6. Abnormal regulation of hormones and electrolytes such as sodium and potassium leads to high blood pressure. 7. Decreased filtration function leads to less urination. Once CKD progresses, it cannot be reversed by medication, making nutritional therapy crucial in slowing kidney function deterioration and managing patient nutrition. Proper food choices help waste metabolism and reduce complications. The best nutritional treatment is to control protein intake and supplement with adequate calories. For CKD stages 3 to 5, the 2020 DOKI guidelines recommend 0.6-0.8 g of protein per kilogram of body weight for diabetics and 0.55-0.6 g for non-diabetics. Caloric needs are 25 to 35 calories per kilogram of body weight. For example, someone weighing 50 kilograms requires 1,250 to 1,750 kilocalories per day and should consume 27.5-30 g of protein if non-diabetic and 30-40 g if diabetic. This is equivalent to eating only 2 to 3 finger-sized portions of meat per meal. If the patient does not replenish enough calories at the same time, he or she will easily suffer from malnutrition or even muscle loss. At this time, the urea nitrogen, BUN, produced by the body will also be reduced. There will be more, and patients will be accelerated into dialysis. CKD patients also need to follow low phosphorus, low potassium, and low sodium diets to prevent complications such as bone disease, itching, arrhythmias, and high blood pressure. Nutritional formula required for patients with chronic renal failure. 1. Sufficient calories to prevent weight loss and muscle loss. Good nutrition is essential to protect the kidneys. 2. Maintaining potassium balance prevents irregular heartbeats. Stabilizing phosphorus level reduces issues related to osteoporosis and vascular calcification. Excessive protein can lead to higher blood urea nitrogen levels, increasing the burden on the kidneys. To meet these nutritional needs, we developed Lopo. No added protein, allowing patients to reserve protein intake for meals. Provides 200 calories per packet, helping maintain weight and muscle mass. Low phosphorus to reduce renal bone disease. Low sodium to stabilize blood pressure. Low potassium to prevent arrhythmias. 3 elements for blood enrichment, improving complexion, reducing dizziness, and alleviating fatigue. Added dietary fiber helps with bowel movements and reduces toxin accumulation. Lopo not only has unique market advantages as a product, but its clinical research has also been cited by the international authoritative 2020 DOKI. According to Lopo clinical study, the following key points are summarized. Clinical studies have shown that Lopo significantly reduces urinary protein excretion, slows kidney function deterioration, and maintains nutritional status in CKD stage 3 to 4 patients using 1 packet daily for 24 weeks. 1. In the Lopo group, protein intake was significantly lower at both week 12 and week 24. 2. In the Lopo group, urinary protein excretion was significantly lower at week 24. 3. Lopo supplement significantly reduces urine protein excretion and bad cholesterol. Compared to other kidney formulas, new Lopo has a distinct market advantage. Most liquid kidney formulas contain high calories and added protein, which is useful for those unable to eat normally but restricts protein intake for those who can. New Lopo, on the other hand, contains minimal protein, allowing patients to enjoy regular meals without exceeding their protein limits. For example, a 50 kilograms person consuming a liquid formula would need to deduct the protein content from the nutrition supplement, leaving only a small portion of protein for meals. With new Lopo, nearly all protein can come from food, allowing for a more satisfying diet. We recommend 2 packets of new Lopo daily, providing 400 additional calories, to be consumed with meals, or as a snack. For diabetic patients, 1 packet per day is recommended. When the estimated glomerular filtration rate, eGFR, drops below 15, dialysis treatment, either hemodialysis or peritoneal dialysis, is commonly chosen. These methods utilize artificial kidneys to remove excess fluids and metabolic waste products. Next, let's introduce new Reno, a nutritional supplement specifically designed for dialysis patients. This segment will cover the nutritional needs of dialysis patients, the challenges they face post-treatment, and how to select the appropriate nutritional formula. We'll discuss clinical evidence and the usage of new Reno for dialysis patients. As widely known, dialysis treatments are typically divided into 2 main methods: hemodialysis and peritoneal dialysis. Hemodialysis involves the use of an artificial kidney to remove excess fluids and toxins, while peritoneal dialysis uses the patient's own peritoneum to replace kidney function. Regardless of the method chosen, artificial kidneys also eliminate beneficial proteins and amino acids while removing unwanted substances, necessitating increased nutritional supplementation, especially in protein intake for dialysis patients. The 2020 DOKI guidelines recommend that dialysis patients, regardless of whether they have diabetes, should consume 1.0 to 1.2 grams of protein per kilogram of body weight. This requirement contrasts sharply with the earlier stages of chronic kidney failure. However, high-protein foods, particularly from animal sources, tend to contain higher levels of fat, cholesterol, and phosphorus. Overconsumption of animal proteins can exacerbate lipid disorders and cardiovascular diseases, while a high phosphorus diet may lead to renal bone disease and vascular calcification, significantly increasing the risk of death for dialysis patients. If a dialysis patient fails to consume enough protein and their nutritional status deteriorates, resulting in low albumin levels, this could lead to edema and an inability to effectively remove excess toxins from the body. Therefore, dialysis patients must adhere to a low phosphorus, low potassium, and low sodium diet, and strictly control their fluid intake to reduce cardiovascular risks. In summary, dialysis patients require not only a high-protein diet but also careful management of fat, phosphorus, sodium, potassium, fluid, and sugar intake to support cardiovascular health. To improve the nutritional status of dialysis patients, nutritional supplements should possess the following characteristics: high-quality protein sources to increase survival rates, nutrients to promote red blood cell growth and alleviate anemia, High dietary fiber content to improve constipation and reduce toxin accumulation. Minimal metabolic burden. No increase in blood phosphorus, potassium, or sugar levels. Improvements in cholesterol and triglyceride levels to protect cardiovascular health. Reno was developed to meet these needs and is the ideal nutritional formula for dialysis patients. Reno key features: 32.6% isolated soy protein. Low phosphorus absorption to help with dietary management and reduce skin itching. Iron, folic acid, and B6 to support red blood cell formation. Low potassium and magnesium to reduce electrolyte burden. Rich in dietary fiber to promote smooth bowel movements. Fluid restrictions during dialysis can lead to constipation, and improved bowel movements can also reduce toxin buildup. Some may question the nutritional value of isolated soy protein. According to the literature, recent developments in protein quality evaluation, isolated soy protein has the same PDCAS score as whey protein and casein. PDCAS, protein digestibility corrected amino acid score, is the internationally recognized standard for evaluating protein quality. Isolated soy protein contains 8 essential amino acids for the human body, is fully digestible, and is completely absorbed. In 1993, the FDA adopted PDCAAS as the preferred standard for protein quality evaluation. Reno uses the highest quality isolated soy protein. Since dialysis patients require a high-protein diet, their daily phosphorus intake will exceed 1,500 to 2,400 milligrams. However, the amount removed by artificial kidneys is limited. Research indicates that dialysis only removes approximately 3,171 milligrams of phosphorus per week. Therefore, it is crucial to choose protein sources with minimal phosphorus burden in addition to medication. The April 2010 issue of the Iranian Journal of Kidney Diseases discusses the importance of educating dialysis patients on managing protein and phosphorus intake. It mentions that plant-based phytic acid phosphorus has an absorption rate of 10 to 30%, while animal-based phosphorus absorbs at 40 to 60%. Isolated soy protein is more suitable for dialysis patients compared to animal-derived milk proteins. Reno has been featured in the American Journal of Kidney Diseases. A study was conducted with 2 groups, one consuming milk protein and the other isolated soy protein. Over a 12-week observation period, the changes in albumin, phosphorus, and uric acid were monitored. The study showed that the group consuming the isolated soy protein formula maintained good nutritional status without an increase in blood phosphorus or uric acid levels. Additionally, this formula significantly reduced cholesterol and triglycerides in patients with high cholesterol and increased HDL, while lowering LDL and improving insulin resistance. Clinical benefits of Reno: effectively improves the nutritional status of dialysis patients. Reduces total blood cholesterol. Lowers blood triglycerides. Reduces bad cholesterol, LDL. Increases good cholesterol, HDL. Improves insulin resistance. Does not increase blood phosphorus or uric acid. Commonly available dialysis-specific nutritional formulas on the market include liquid Nepro HP and powdered Nutrino. Nepro HP is designed with higher calorie and protein content and is more suitable for patients who cannot eat normally, often used as a tube-feeding formula. Liquid formulas typically contain casein as the primary protein source, which has a higher phosphorus absorption rate from milk proteins, requiring attention to phosphorus absorption to avoid cardiovascular burdens. Given the concerns around phosphorus, Nutrino is more suitable for dialysis patients who can eat normally as a nutritional supplement. The clinical trials of Nutrino mentioned earlier demonstrate that its use can maintain patients' nutritional status while avoiding issues with blood phosphorus and lipids. Recommended usage of Nutrino as a nutritional prescription. If the patient's albumin (ALB) level is below 3.5 mg per dl, it is recommended to take at least 3 packs of Nutrino per day. If ALB is between 3.5 mg per dl and 4 mg per dl, it is recommended to take 2 packs per day and add 1 extra pack on dialysis days, totaling 3 packs. If ALB exceeds 4 mg per dl, it is recommended to take at least 1 pack per day and add 1 extra pack on dialysis days, totaling 2 packs, to maintain optimal nutritional status. Nutrino can be consumed as a breakfast drink, afternoon snack, or whenever hunger strikes.
喝了一副健康财富。